Hello and welcome everyone. Um, Hello and welcome everyone this Thursday evening. Thank you all for joining, and we appreciate your valuable time. So thank you very much, the attendees. I can see you have joined Paul, Kezia. Thank you very much for joining. John, thank you very much for joining. Ivy, Gidraf, thank you very much for joining. Evans, brace up for a very information-packed session. Have a notebook, a pen, a notepad on your phone to those keen on learning and preserving knowledge. So we have Dr. Misango, an expert in these matters, and we'll open the stage to him later. It will be point upon point, knowledge upon another. So get to know the signs and symptoms, how to diagnose, prevention, treatment options, etc. So we also have a question and answer session with the doctor after his presentation. So feel free to ask any of your questions on the chat box, which is it's on the bottom right of your screen. So feel free to share any feedback and drop your questions and any challenges you experience as we proceed. So you'd like also to grab a cup of coffee as well, or hot chocolate or tea as we take off in a few minutes. So we'll just take a few minutes as we wait for additional people to join, and we take off our flight shortly. So you'll also want to know that My Health Africa was awarded the Best Health Tech Company in Africa for 2022 by the Global Startup Awards in a competitive nomination process, with the award ceremony happening recently in South Africa. So yeah, up to some awards as well. Remember as well, also at the end, we'll show you on how to connect with the doctor. So please hold on for that. So I can see Dr. Fazana is asking what awards did we win? So we won the Best Health Tech Company in Africa for 2022 by the Global Startup Awards. It was in South Africa in a very competitive nomination process with the award ceremony recently attended by our CEO who was in South Africa like 1 week ago. So thank you again for joining. Just be patient for a few minutes. We're about to get started shortly. So if you're experiencing any challenges, any comments that you'd like to give, remember there's also the chat box at the bottom right. You can easily type a message and send it to us, and we'll have a review. And also in the FAQ segment after the doctor has presentation, we'll also go through some of your questions, some of the questions which were sent earlier on to us. And also any new questions, I will be open to check with our good doctor. So remember, in this webinar, we discuss matters ED, erectile dysfunction, and other performance disorders. So it's a very good platform to learn a lot on this topic, which usually is usually not spoken of in many areas due to, of course, you know why. And so we saw the need at least to bring up such webinar, so that anyone who has any questions, any persons are suffering from this etc., so can get to learn a lot more about this. So my name is Michael. I work with Health Africa. I'm going to be a moderator today. I work with international medical treatment. I've been working with IMT for a few years, for 3 to 4 years, as an international patient support. Currently, I'm working as an international patient support specialist, supervisor with Health Africa and international medical treatment. Also, Faith, next slide, please. Yeah, so just to give you an understanding of what we do. So as My Health Africa, we are a full service doctors booking platform. We assist patients to find and book the right medical specialists, the right medical services, the right treatment with doctors, both locally, regionally, and internationally. So we partner only with the leading medical facilities and hospitals, as you can see in the key medical destinations. So My Health group as well includes also international medical treatment, from where we work with a select leading hospitals across the world. We work with facilities in Dubai, several in Dubai actually, American Hospital Dubai. We have hospitals in Turkey, at Acibadem Hospital, in Egypt, Singapore, Malaysia, Thailand, and India as well, which is a common medical tourist destination. So if you need to, you can check our website at My Health Africa, www.myhealthafrica.com, and also international medical treatment, www.medicaltreatment.com, to reach out for any assistance for a doctor's booking platform, and also for any overseas medical treatment. So just to give you a clear understanding on what we do, we assist patients to find the right medical specialist. In this, we mean to find the most suitable doctor. For instance, a urologist, just like Dr. Misango today. We also work with dermatologists. We help you to find dermatologists, neurologists, oncologists for cancer cases, for example. So we help you to find the right medical specialist for your conditions. So we also help you to find the right medical services. So to book for the services, I mean to book for in-person appointments. That's to meet the doctor in person at their clinic or hospital, and also to for online telemedicine consults, which you can have either by your phone. We have an app as well, or you can also do it on our website, on the web version on our website. So you're also able for another service is to obtain remote second medical opinions, and also access international medical treatment for complex cases. We also help you to find the right medical treatment. That is, we assist patients to find the correct treatment in our leading providers, both locally, regionally, and internationally. So we have two platforms where a patient can book their appointments or have their teleconsults. So there's either the web version, where you can get access to our website, www.myhealthafrica.com, and the other alternative is to use our Android app. So currently it's available for Android users only. We are working to develop the iOS, which should be available soon. And the app is also available on Google Play Store. You can there's the link there, which you can click, which we share the link at the end as well, where you can get to click the link to download our app. So I'd like now to introduce Dr. Misango, a urologist at Meso Center. He's at the forefront of men's healthcare with over 25 years of experience in both private and public sectors. He's the Senior Assistant Director of Medical Service, Government of Kenya, Head of Surgery, Kemba Level 5 Hospital, Program Director at Koseska, founder of the Meso Center. So let me leave it now to the pros. Karibu sana, Dr. Misango. Thank you very much.
Good evening, audience and everybody around here. Thank you very much for that kind introduction. As mentioned earlier, I'm going to give a presentation on erectile dysfunction. And the way I want us to go through this session is a bit different from how the slides have been put, because I realize I'll be talking mostly to an audience that mostly wants to interact. So I will have a very brief session where I just give an overview, which will be able to give you at least a highlight of the points that we look at when you're discussing erectile dysfunction and other disorders of sexual function, so that we leave the longer part of the discussion to be a kind of a question and answer session, and that will be more engaging and more targeted to whatever it is that you have, apart from looking at the technical aspect of it. So those are my names. I'm a consultant general surgeon and urologist, as been indicated, and right. Attain an erection or to sustain one for long enough to have successful sexual intercourse. Can I have the next stage, the next slide, please? And it has also been called impotence by some people, because previously in the elder days, we used to talk about people who are useless and they were called impotent. And that was basically one of the biggest insults to a person, to be referred to as impotent. In other words, a man without any strength. These days, as we go on, we realize that it's basically something which is user dependent, because it depends on whether the people who are engaging together, what their previous experience has been. Because obviously, if somebody is a virgin, they will not have the context of what erectile dysfunction is, apart from what they've read. But somebody who has had more exposures will be able to classify somebody as being having erectile dysfunction, or will give the impression of somebody having some inability to sustain it. The WHO basically describes it that if at all you stay for less than 4 minutes in a man without sustaining an erection for 4 minutes, it has been classified as erectile dysfunction. But I want to disabuse this notion from your heads, because it is something which is user dependent. Next slide. Now, do we worry about erectile dysfunction? um, Erectile dysfunction is presents in a very dramatic way, because it will be something that will be a manifestation of something that is troubling a person either physically or psychologically. And why we put a lot of attention to erectile dysfunction is because it ceases to be a physical problem and becomes a psychological problem, which causes a lot of stress in couples and relationships. And it gives a man a lot of esteem issues. And of course, when somebody is not able to have an erection, it goes without saying that they're going to have infertility, which is inability to have children. Um, the other thing which we normally say in urology, the importance of erectile dysfunction, especially in the senior citizens, is that it normally is an indicator of an underlying medical condition that interferes with the delivery of blood into the penis and thereby other organs of the body. So in some areas, it actually is the earliest indicator of somebody who is having a problem that can result in either stroke or a heart attack later on in life. Next slide. Next, please. In terms of occurrence, this is data from the US, so we don't have a lot of data that has been done in our country, but if you look around, you might find generally the statistics are about the same. 2 out of every 10 men will be afflicted. This is US data from the US, but it transforms also to our Kenyan situation and Africa at large. Now, when you break it down in terms of percentages and age groups, we do not really talk about erectile dysfunction in men under the ages of 18 years. Okay, teenagers, we don't consider them in that group because they have other reasons to worry about apart from sex. But generally, for younger people below the age of 40, the incidence of erectile dysfunction is less, about 5%. As you grow older, men over the ages of 40, you find nearly half of them will be having erectile dysfunction. So it is a very common condition, contrary to what most people will want to make it believe. I mean, will want to believe. Ladies should be assured that if your man has erectile dysfunction and is over the age of 40, he represents nearly half of the male population with the same problem. So do not be so hard on them. Same thing with the men who are affected. It is very common. So you should have this, what we call comfort and security in numbers. Huh? And don't be so hard on yourselves, because the harder you get on yourself, the harder it becomes to sustain an erection later on, because it becomes a psychological issue. Now, as we grow older in men over the ages of 70, then more of them will be able to, will actually be having issues with the erection, opposed to the ones who can be able to have a normal erection. So it's a problem that basically gets more and more pronounced as we age. Next slide, please. The following slide is just to illustrate to you the anatomy, or how the appearance of the male system is, that is responsible for an erection and sex. I would want you to basically keep this diagram in your mind, because we'll refer to a lot of these systems as I go in the presentation and later on. And this, we are all aware, basically, this is the testes which produces the male hormone and also the sperms. So during sexual activity, after the necessary stimulation, blood will flow into this gland, which is called the penis, through some tubes. These tubes, basically, when they get blood inside, then they engorge, and this gland straightens up. And contrary to belief, there's no bone inside. It basically just rigid tissues that expand when there's blood inside. During ejaculation, sperms will be propelled through this tube, which we call the vas deferens, or the spermatic duct, from the testes all the way to be ejaculated at an area which is called around the prostate. This is where the bladder is. We have a gland here called the prostate with a lot of its own problems, and then the semen will be ejaculated into the vagina. Now, a lot of the issues to do with sexual problems will be centered around inability to have an erection, somebody who ejaculates too fast, somebody who ejaculates back into the bladder, somebody who has a blockage within here so they cannot ejaculate at all, and so many other problems that you're going to come across. Next slide, please. Next. The just appearance of the penis in a cross section to let you know the two tubes that I was talking about, where the blood fills for the testis, for the penis to be erect, and this other tube down here is where the urine will be coming out of. So it's separate from the erectile tissues of the penis, which are on both sides of that cylindrical structure called the penis. Next slide. Next one. This just shows the blood flow. Next, please go on. Next next one. Next. Yes, this just a small illustration of how a normal erection occurs, and the factors that are responsible for a normal erection. Now, as you can see, we have the brain here playing a very important role. I use this diagram a lot to illustrate to people because sex begins and ends with the brain. Now, you will have stimulation into the brain coming from different parts, either what you say, what you hear, what you smell, what you feel, and so many other things. Basically, the brain has to be stimulated, and then that sexual stimulation will be transmitted via nerves and blood vessels to this organ called the penis, so that when the blood flows into the penis, that's when you get an erection. So, there will be hormones which are in the body. This is basically illustrating one of the biggest glands that is responsible for production of hormones. Then the nerves from the brain, that stimulation that you have, it will reach blood vessels and release a particular important compound called nitric oxide, which makes the blood vessels open up like a pipe. This blood vessel, when they open up, now blood will go into these two tubes in the penis. And when the blood goes inside, the penis erects. Now, in tandem with this, if you have any problem that's affecting the hormones, like maybe somebody has had some problems in hormone production from their testes, somebody who is on medication that interferes with their hormone production, somebody who has a disease that interferes with the hormone production, it will have an effect on the brain and the rest of the body. If somebody has issues with the brain, stress, anxiety, um, and basically any factors that will be interfering with the concentration, then you'll have less stimulation. If you have problems that are affecting the nerves, like diabetes and some virus infections, then the nerves are not going to be transmitted. If there's a problem with the blood vessels, including diabetes, high blood pressure, radiation, people on treatment, some particular medications make basically this the vessels constrict. People who are heavy smokers or people who are ingesting any chemicals that basically interfere with the blood flow, then you'll have a problem. Uh, then obviously on the penis, if at all there's any disease that interferes with how the penis either erects or how it sits, then you'll have a problem with the erection. Next slide. Um, this is basically just a summary of the things I've talked about. We can go on next one. Now, people with a person who has erectile dysfunction, how do they come and how will you know somebody has a problem with erection? In this, we have to distinguish and separate between issues with erection and problems with what you call premature ejaculation. They are all sexual disorders, but they're different. However, one of them can result to the other one. Somebody with erectile dysfunction can get premature ejaculation. Somebody with premature ejaculation can get erectile dysfunction. And we normally want to know whether this is something that occurs to somebody only during the daytime or at any time, or in the absence of sexual stimulation. We need to know, or I want to know, whether you have normal erections at night or the morning erections, because most men are supposed to be having this, especially when they are not having any anxiety at the time. And this is important in distinguishing the ones who are having erection disorders due to anxiety and the ones without anxiety. Then the amount of penetration somebody is able to achieve, because some erections are strong, others are weak. Uh, we look at the age of the person. If you're under 18, of course, it doesn't bother me so much if you're not able to have an erection. If you're over 80, it also will not bother me so much in terms of wanting to find out what problem is there, because we are looking at erection being to be able to have, number one, successful sex, to be able to have a good relationship between couples, and of course to have children. We normally want to know whether somebody is physically fit and whether they're using any medications. And when we examine, the important thing is just to know the general appearance of somebody and whether they're having normal, what we call normal vital signs. Vital signs are whether your blood pressure is normal, whether your pulse is normal. Generally, your general appearance gives an idea whether you might be having an underlying position, underlying cause or not. Next slide. Next. In terms of investigations, what do we do when you find somebody has a problem? For most people, we don't need any investigations at all. However, in realization that many people are so much stressed by the condition and they are always worrying because in this era of internet, people read a lot and you worry about the worst possible situation that you might be having that is causing an erectile dysfunction. And so we do some basic tests, and that's what I normally do at my clinic. I subject the patient who might come alone or come with a couple to some routine tests just to know how you are. And the common thing I do is a full hemogram to look at the number of blood cells that you have. I look at a blood sugar to test for diabetes, your cholesterol levels, because this affects how the blood flows, and the fats in the body. Um, Urine test is important because it gives an indication whether your kidneys are working or not. People who are having chronic kidney conditions will have a problem with that, their blood flow and direction. I also do tests on the blood hormones. These are the hormones that are dominant in a man. We have some hormones which are dominant in a female, others dominant in a man. So the ratio of these hormones, how they are in a man's body, sometimes will affect how the man will be able to have an erection or how confident they are going to be when it doesn't work well. The other tests that are indicated there are rarely done. One is basically we just inject some chemical into the penis to see whether they can have a normal erection. But we rarely have to go to this extent because this is for people who we suspect are having a completely abnormal penis due to a particular condition that they might be having. And ultrasounds, I normally do mostly to check how the testes are and not so much on the penis. Next slide. Next. Now, how do you treat erectile dysfunction? In summary, the treatment will depend on the cause. Because I said there are very many causes of erectile dysfunction, and all those ones which I mentioned should be treated. Now, an important component of treatment of erectile dysfunction is exercise and diet. Because as I explained earlier on at the beginning, everything depends on good nerve supply and blood flow. Now, underlying blood flow and good general well-being. Now, the well-being of a man, we say you are what you eat. And the diets which have been known to be healthy for most parts of the body will also be healthy for the man's sexuality. Now, this will include diets which are rich in arginine for the people who would want to know in terms of diet. I don't want you to be so much concerned. If you just keep it basic, what you're told in school, have a well balanced diet with vitamins and a lot of water. That takes care of everything because arginine is just one of the commonest amino acids in the body, and it comes from all natural foods that you can take, from nyama, red meat, white meat, vegetables, fruits. Everything basically has got arginine as one of the small building blocks that your body uses to make an important amino acid that is useful in keeping the body in its natural balance. Now, this arginine, as much as you're going to get it in some food, it is made in the body. So it is called a semi-essential nutrient. So even if you do not eat it, you have it in your body, you produce it, but your body needs to be healthy for you to produce it. The others are nitrates. We all know nitrates basically come from plants. So as long as you take green leafy vegetables from the shamba, you have nitrates, which your body will use to make nitrates, which are important in the production of the more important chemicals that your body will use to make blood flow. Now, capsaicin is an interesting one because This is a chemical that is found in most of the chilies that you take, and it does not give you any useful calories, but it has been found to be very good as a micronutrient that takes care of people in terms of antioxidant. It's an antibacterial, and generally it is a, a chemical that the body uses to speed up a lot of the processes that keeps somebody healthy. And people who take chili will testify that if you take chili, you generally get a feeling of hotness in the body because it improves the respiration, I mean, and the metabolism. So these are chemicals that are known to generally improve the well-being of somebody. Next slide. Next. Um, Now, in terms of treatment, um, following on what I just said about the general treatment of erectile dysfunction, we have medications that have been known to be effective, and we use them as a first line in patients who present with the disease. The commonest are what we call PDEs. I'm sure anybody who has been to a hospital with erectile dysfunction has received this treatment. Others are bought them off the counter. Commonly, we have the Cialis, the Viagras, and the like. They are very common and relatively, generally, very safe, but they are best used under a prescription. The others which are available, not very popular around, are medications that we inject into the penis when somebody wants to have an erection. For the ones who don't want to, keep on taking tablets. And also, we do replace hormones for people whose hormone levels are down. Other devices that have been used to take care of erection are a bit more crude. We have instruments which can be inserted on the penis to to basically suck blood so that the penis engorges. Others, and I've seen it being used by people in the entertainment industry, they put a ring to try and with the blood flow so that blood penis and remains there. Um, and then, of course, we have surgery which can be done, a permanent method to insert things for people who have tried everything and nothing is working. We sometimes do surgeries to give something like an artificial erection, which can be controlled. The olden days, it used to be an artificial permanent erection, but these days you're able to give implants that give an artificial erection that can be controlled, can be relaxed, and obviously at the end of it all, we need somebody to have a change of lifestyle where we encourage diet, improvement of okay losing the body weight, exercises, and cutting down on smoking. Huh? And I think that takes a bit of what it is I wanted to just share with the audience so that we can leave a bigger part of this to the question and answer session. And thank you very much for your attention. That's the end of my presentation. Back to you at Africa Health, Health Africa. Thank you.
Yeah, thank you very much, Dr. Misango, for the very informative session. We really learned a lot, especially as getting a scientific point of view on AD. So let's get straight to the questions from our audience. So we have someone asking, how can I prevent premature ejaculation? I believe maybe you've answered that.
You want me to answer one question at a time, or I take several together and then I can answer them in a group? Depending, I'm not
Um,
seeing the questions here on my screen. Huh? I think something
oh,
went.
okay. Yes.
Yes. How would you want
Yeah,
us to go about it?
so we can go one by one. I can maybe just give a brief answer on each.
No problem. Fine. How do you prevent premature ejaculation? As I said, everything depends on the cause. Now, one of the commonest causes for premature ejaculation, I will tell you, is masturbation. Okay. or people who do not have enough sexual experience. So masturbation and inexperience are the commonest cause of premature ejaculation. So because once the it is normal for boys growing up to masturbate, which are in the testes have to come out. Now, and these sperms will come out either by a boy having a wet dream or masturbating or having a partner. Now, what most boys do, they will find a way of ejaculating by deriving self pleasure. And it's supposed to be a stage, but some of them basically they exceed the stage because even when they reach an age when they're supposed to be having normal intercourse, they're still masturbating. So the circuits, I told you, sex begins with the brain and ends with the brain. So the circuits short, you basically end up having a short circuit of the system. And the easy way is the one the body is choosing because masturbation, the only objective is basically to ejaculate. So when your body has gotten used to this, even if you get a partner, then the urge is just there. Okay. So the thing to do is we identify the cause and take care of it. Now, the other thing, as I said, is the longer you stay without having sex, the more the semen will want to come out and the sperms, because this is how the system is structured. And if somebody has stayed for long without having sex and they have sex, they'll have a premature ejaculation because the sperms want to come out, and it's not a disease. And that's why even young people joke about shot ya kwanza ina haraka sana, ulikuwa na haraka kama shot ya kwanza. So this is expected, it wants to come out. Now, what we normally insist, because young boys, when they get this, they get very frustrated and very anxious. Huh? Know that it's normal, and the best way to deal with it is to accept that it's normal, especially the first time. It gets better with the second and the next. But if you worry about it so much, you will not be able to have the next erection because
Mm.
you now get scared. Okay, so we look at it. Sometimes, if somebody has gotten into a situation where it's becoming so frustrating, we normally say we train the if the system has been should you say it has been convoluted so much and mixed up, huh? Then we can give some medications to reverse the process, but I prefer not giving medications for a long period of time just to get the system back. So yes, there are medications to prevent premature ejaculation. Yes.
Okay, thank you very much for the very good answer. So another question is ED genetic condition at all?
It depends on the cause. As I said, everything in this there are very many causes. Depends on the cause. If somebody has a hormonal imbalance, then it is likely that the children will also have some hormonal imbalance. If somebody has some metabolic disorder like diabetes, it's likely that people will also have diabetes. So there's no straight answer. But yes, there's some ED that runs in families, and a lot of the EDs will not be running in families because in the majority of people, ED, especially the young population, it will be due to either anxiety, what you call performance anxiety. But as the older you get, the more you begin having diseases, lifestyle diseases that they might actually be a congenital cause. Now, for other people who have been born without a testis, they might have a problem with their erection because they do not have hormones. And this could be something they were born with, and that is congenital, as opposed to genetic. So everything depends on the cause. And that is why we say it is important that you seek medical advice before you begin blaming your parents for your position. Huh? Yes.
Oh, okay. Yeah, sure. So another person is asking us, so why do African men suffer more from impotence than other ethnic groups?
That is not factual, unless he has
That's a myth, right?
that is actually not factual. So that's why I'm saying I will not say much about that. There are enough. There's enough which has been written according to different race groups how the erectile dysfunction rates are in different population groups, and they basically are similar in different populations depending on what their definition is. Huh? So, but as I said, it is user dependent. If you have a woman who has had multiple sexual partners, it will take a bit longer for you to prove to her that you are not having ED, as opposed to people who are in communities that basically marry virgins. You understand? So it's seizure
Yeah.
dependent. But generally, we don't have a distinction about Africans being stronger or weaker. Yes.
Oh, okay. Yeah. Another one is, do people with ED suffer more from urinary infections?
Straight answer, no. They don't
Oh,
suffer more
okay.
from urinary infections. No.
All right. Yeah. So, what causes leakage of urine in men once they have completed their short call?
Sorry, just come again.
So, what causes leakage of urine in men once they have completed their short call?
That's a different problem altogether.
Oh, okay.
It's outside the subject of this discussion, but it is urology. It all
Oh,
depends on whether somebody is an infant, a child, an adolescent, an adult, an elderly man. These are all range of spectrum. So that requires a whole consultation in a room, and then you can be able to get to the bottom of it. Yes.
oh, okay. Yeah. Thank you very much. Yeah. So we have another query. Hello, doctor. Thank you for this noble venture. My query is I've been taking Priligi 30 milligrams and Cialis 5 milligrams, oxybutynin. I'm still dripping even though my erection has improved. Is there a cause to worry?
Now, one thing I'll say is, it's difficult to have an online consultation with somebody whose background I do not know. Okay,
Oh, okay.
so I will not be able to go into specifics of people's specific medical conditions because it's
Mm.
actually not ethical to try and even purport to give a consultation on this platform. What I'm hoping to do is to answer questions pertaining to the discussion we just had. But
Oh, okay.
people's specific problems, they have to be specifically looked at in a medical center with a urologist so that we get to know your background because I have to know from you what has been happening since the problem began, what you've been using, how old are you, then I examine you. There's so many things, and it's out of the scope of this program. Yes.
Oh, okay. Yeah. So another one is, do STIs and HIV directly relate to ED?
Do STIs and
And HIV
yes?
directly relates to ED?
So you can say indirectly yes, because anytime somebody has a condition that affects their what they call their private part or their genitals, they will have some anxiety when they face their partners, and that definitely contributes to erectile dysfunction. If their partner is suspicious of their of the man's HIV status, or their partner is anxious about a lesion that they see in a man, and ask a question, it is very, very, very common for the man's mind to shut down and not to get very much into the mood. So, yes, they do affect indirectly, but not directly. Occasionally, there are some sexually transmitted infections in a man that can actually cause some deformities in the penis, which would cause now an erectile dysfunction. But that is more rare than the indirect way.
Oh, okay, thank you very much for that answer. So another one asks, what's the difference between ED and BPH? I believe that's benign something prostate, something like that.
Yes, the differences are pretty obvious. ED is the inability to achieve or sustain an erection for an adequate duration to be able to have satisfactory sex. BPH is, as you said, benign prostatic hypertrophy, otherwise called the non-cancerous enlargement of the prostate. When a prostate enlarges, it can cause problems that are
Mm.
mostly related with the passage of urine, but it can also cause erectile dysfunction. So BPH can cause erectile dysfunction, but ED is not BPH, right?
Oh, okay, thank you very much. So another one is ED a lifelong condition or can it be treated until a full recovery is made? And then if yes, how long does the treatment go on for?
It depends on the cause. Everything depends on the cause. There are some people with ED, we can treat it in 1 day. Some people with ED, you don't need any medication. Some people with ED, you need lifelong medication. Some people with ED, you need surgery. So and some people with, not some people, all people with ED, you need a lifestyle change and diet. So it also depends on the cause. Yes.
Okay, thank you very much for that. So another one asks, does orchidectomy affect ED?
Yes, it does.
Okay, thank
Orchidectomy is the removal of a testis. Now, when a testis has been removed, depending on which age, at which age it has been removed, it sometimes gives some men some low self-esteem, and that by itself can cause ED. If somebody has had an orchidectomy due to a problem with the prostate, with the testis, like a disease, maybe TB or something, then it is possible that the disease has destroyed the testes. So it is possible somebody can have erectile dysfunction. But if somebody has had removal of the testes because the testis was injured during an accident and the other testis remains, and their mind is clear and they are not very stressed, then they have got no reason to have erectile dysfunction.
Okay, yeah. And maybe a follow-up to that one. How can one prevent ED after orchidectomy?
After orchidectomy, as I said, it all depends on the cause of the
Oh, okay.
what made the person get an orchidectomy in the first place. Huh? Yes.
Yeah.
So that one would be a bit. It is dependent on the reason why the person had this. But
Oh, that was
generally, for most people, what I just want to emphasize, the importance of healthy living, diet, exercise, healthy living, healthy eating. You are what you eat. Yes.
Oh, okay. Yeah. So another one asked, what's the effect of prostatitis on erection, and what's the test for prostatitis? Please shed some light.
Now, what he's talking about is a condition called prostatitis.
Oh, okay.
Prostatitis is an infection or when the prostate is what you call inflamed. A disease of the prostate is called prostatitis, or when the prostate is infected or inflamed by anything. It's a painful condition. It mostly interferes with urination, but it can also cause some painful ejaculation. It should not really cause erectile dysfunction unless, as I said, somebody now lets it get into their mind. Because any condition that you have around your genitourinary system can affect your mind and cause erectile dysfunction. But by itself, prostatitis is a condition that can be treated. It's a painful condition of the prostate that can be treated with antibiotics and pain medications and
Thank you very
frequent
much.
ejaculations. Frequent ejaculations,
Oh,
yes.
okay. So another ask, are there any benefits of masturbation? And secondly, does it directly lead to ED or PE?
Yes, answer to both questions is yes. There are benefits of masturbation. If somebody doesn't have a sexual partner and they're adults, semen, sperms have to come out. These things are formed in the body and they have to come out. So if you don't have a partner, you have to get those things out of your body. Otherwise, people are going to get some problems. Huh? The only person who can stay without having ejaculation and masturbation are people who have been castrated because then their bodies are no longer the bodies of a typical man. As long as it's a man with normal hormones and doesn't have a sexual partner, sperms are being produced and those sperms have to come out. So if they don't come out in a wet dream, the man has to masturbate, or if they come inside, he stays inside them, the person gets some problems. Now, so that's the benefit of masturbation. The disadvantages of masturbation, yes, it makes people get used to masturbation as being the shortcut to sexual satisfaction, and they do have erectile dysfunction later on in life. Yes.
Okay, thank you very much for that answer. So please note, I will have the contacts at the end. So please don't worry. I will be able to reach out to the doctor, give a platform on how to reach the doctor. So another question is, does penis enlargement cream work?
Penis enlargement cream, does it work? It depends on the age somebody is using it. It depends on the chemical which is inside, and it depends on what is the purpose for the enlargement. Penis can be enlarged at whatever age, yes. But more importantly, what I tell people, if you are using a chemical that has got a hormone to enlarge your penis, then you're going to get erectile dysfunction because your body eventually begins not having the hormones that it has in its body, they're suppressed. And we see a lot of this in people who are bodybuilders or people who apply some creams in their bodies. The penis will get bigger, yes, but it will not be erecting properly.
Okay, thank you very much for that. So another question is, what tests do you do to check impotence once consultation is done with yourself?
What steps do I?
What tests do you do to check impotence once consultation is done?
Oh, okay. I think I'd alluded to them. The general tests I do, it all depends on the age of the patient, but in general, I do a full hemogram. That's a full blood count. I do the patient's uh, blood sugars to look at the average blood sugar control over the few months. I look at their cholesterol and other fats in the blood, and sometimes I look at the hormone levels, the hormones as baseline. And then other tests depend on what I have seen in the consultation that warrants further investigations. Yes.
Oh, okay, thank you. So another one asks, which exercises can one engage in order to keep the penile muscle strong?
The idea is not to target the penis muscles. Huh? The idea is to target a good blood flow, because it's not the muscles which cause a good erection, but the flow of blood into the penis. Okay. So what we do is we encourage what are called cardiovascular exercises. Aerobics are very much okay. Anything which basically improves the blood flow, all right? Improves the heart rate is good. What is good for the heart is good for the penis, and what's good for the penis is good for the heart.
Oh, okay. And so someone asks, do drugs like Manix and Zeman help? And genetics, how can it be treated?
Now, there are so many formulations outside there in the market. I will not pretend to be an expert on all of them. The ones that I am conversant with mostly are the ones which you use in the medical profession. Now, the ones which are used in the other world, I will not say that they're exploiting people, but it is in recognition that this is such a common problem. As I said, people over 40 years, nearly half the men over 40 years will have a problem with erectile dysfunction. And the tragedy is most people are scared of going to talk about the problem because they think they are alone. They do not realize that there are so many. And so there are so many drugs outside there in the market which are uh, touted, or they are basically being displayed as being able to take care of your unique problem. So many people will try them out. Whether they work or not, it all depends on whether you have a problem that can be taken care of psychologically or not. But if you have a medical problem, then most of those things will not work. Some of them actually do cause some problems because they do have some chemicals in them. Now, I don't know what chemicals the one he's talking about have, because those are basically brand names which are being taken around for people. But so I will not talk much about what is not directly within the medical circles.
Oh, okay. So another question is, does prostate cancer contribute to ED?
Yes, the answer is yes. Prostate cancer will contribute to ED. Simple answer, yes, it will contribute to ED. The cancer itself can contribute to ED. The treatment of the cancer will contribute to ED. Radiation will contribute to ED. So prostate cancer and ED go hand in hand, yes.
Oh, okay. Yeah. So another one is, can cycling cause ED?
Cycling indirectly can cause ED. Same thing with either bicycle or motorbikes. Yes, they have been associated with ED because of compression of nerves around the area of the man's private parts, which go to supply. Because as I said, this is an interplay between the mind, the nerves, and the blood vessels. So yes, it does contribute for people who ride bicycles, especially with the saddles which are a bit narrower, that apply a lot of pressure in between the legs. Yes.
Oh, okay. So we have another question. What causes to lose appetite? I think what causes to lose sexual appetite?
Many things. Now, sexual appetite is what you call libido. Okay. It's different from erectile dysfunction, but low libido will cause erectile dysfunction. The causes of low libido are so many. Anything can cause low libido. Either something which is stressful, when somebody is not happy with their spouse, when somebody has had a hard day at work, when somebody is sick, anything can cause lost appetite with sex. Huh? Yeah. Anything in the sun.
Oh, okay. Thank you very much for that one answer. So another question is, does masturbation cause ED? I believe you already
Sorry,
answered
come
that.
again.
Does masturbation cause ED?
I think we've already gone through that.
Yeah, we already checked on that one. What foods or supplements help ED condition naturally?
Sorry.
What foods or supplements help ED condition naturally?
Now, I talked about a normal balanced
Balanced.
diet.
That's
You do
yeah.
not need any supplements for your ED. An adult does not need supplements unless the adult has a nutritional deficiency due to a disease. He does not require nutritional supplements to improve his CD. He just needs to eat healthy.
Oh, okay. Yeah. So we had another question on, do you have any advice on micropenism?
It depends on what somebody wants to do with a micropenis.
Oh,
Yes, because do they want it to get bigger? Do they want to get children? Do they want to have sex? You see, there's so many things. A micropenis is a condition, and it depends. There's always something that can be done depending on what somebody wants to do with it. What does somebody want? Okay, so that's it's a wide subject, huh? Yes.
so can you reassure people that they are not alone and that it affects so many men?
That
AD.
surety, I can give that surety. The way I started the program, I will tell it again here. You you are very many. Okay, for people over 70 years, 7 out of 10 will actually be having AD according to the figures from the US statistics. For young men over 40 years, between 40 and 70, nearly half of you have ED at one time or another. For the young people between 20 and 40 years, huh, these are the ones who I can say maybe they are more active. But even in those ones, huh, you'll find nearly 5% of them will have ED. So ED is very common. It is very common, but it is a condition which people hide. It's very common. You can do either nothing about it or you can seek medical help and you can get better.
Oh, okay. Maybe a last one.
Yes,
So
please.
maybe any advice can you, what advice can you give on the excessive use of Viagra for persons maybe with ED? We had cases usually here of very many
Excessive
cases.
use of Viagra, I will tell you, it also depends on the age.
Okay.
If Viagra has been prescribed by your doctor, Viagra is very safe as a medication. Contrary to what people talk about in the village or in the streets, Viagra or sildenafil, these are very safe drugs, but used improperly, they can cause a problem. In the senior people who have a cardiovascular problem, a problem with their blood vessels, trying to have an activity called sex, which is physically very exerting, in somebody who is not physically fit, can cause death. So the death is not due to the Viagra, but the activity, which is excessive. In younger people, it's unlikely somebody will have a catastrophic event. But what happens, excessive use of Viagra in young people, is they become dependent on the medication and they cannot function without the Viagra because their system short circuits. As I said, what you teach your body is what your body gets to learn. So if you do not have a problem with erection at a young age, do not use the Viagra because your body will now use that instead of developing naturally, becomes dependent on the drugs. So either in other population groups, it can cause a problem. If you have a problem, then we fix it. We fix it by you going to a proper place and getting the proper advice. If you go and pick Viagra from the shop, it might work in the short term, but you basically might be masking a problem, or at the very worst, it can end up being catastrophic because your body cannot handle it. Yes.
Okay. Just to understand, there are times when doctors usually advise for Viagra, That's for actual medication.
Yes. Yes,
Oh, okay.
they do.
Yeah. So another question is, how long should sex last? I believe you mentioned 4 minutes.
I said, let nobody have a figure in their minds. It is user
No.
dependent. If your partner is
Oh,
happy with 20 minutes, fine. If your partner is happy with 1 minute, fine. It is user dependent. You basically run your own race, finish it happily, and you're all happy. If you try to run your race according to other people's race, just like a marathon, you'll burn out. So run your race, be happy, and if at all both partners are happy, who is this person to come and tell you that you're taking too short? So run your
yeah.
race. Yes.
Yeah. Yeah. So maybe a last one. We have someone who said I joined late, but would like to know if the shape of the organ has anything to do with ED.
Sorry?
Um, i- uh, is the shape of the organ, does the shape of the organ have anything to do with ED?
Yes. The shape of the organ can have a problem if they, because we have people who have excessive curvatures of their penis. It's excessively curved either on the side or upwards or downwards, so that erection becomes extremely either very painful or they cannot be able to penetrate well. If somebody cannot penetrate well, then they'll begin having erectile dysfunction because already it is an abnormal erection. So it can cause many other problems. And these are the people who we normally say it is good to see your urologist so that you can be advised whether this abnormality can be corrected, because a lot of the abnormalities of the penis can be corrected by surgery.
Oh, okay. Thank you very much. That's well understood. I think that's it. We have answered most of the questions. So
Yeah.
I'd like to inform our audience, if they like to book an appointment with Dr. Misango, you can kindly WhatsApp our patient coordinators on the number there, 0711082072. Alternatively, you can also go to a book on our site. There's the link also posted there on our chat box. You can check, and all this can lead you to make a booking with a good doctor, Dr. Misango. We appreciate you, Dr. Misango, for taking your valuable time to speak to us, to train us, and even to answer most of our questions. I'd like to appreciate all the attendees. Thank you very much. Asante sana.
Thank you very much and have a good evening.
Okay. So to all our audience, we appreciate. For My Health Africa, thank you very much. You can book our packages. We have available packages on our app, male wellness packages, female wellness packages, female fertility test packages, antenatal packages with 35% discount only if you make a booking through the app. So thank you again all for joining and taking the time. Appreciate our technical team, Faith in the background, and all who made this a success. Asante sana. Have a good night.